So, why global health matters to the US? An intriguing question. I'll give you some perspectives on it. For example, if you think about the cross learning opportunities of health interventions, many health interventions that we use today in the United States were actually developed and perfected outside of the US. The classic examples of oral rehydration therapy that's saving millions of lives every year in the United States and elsewhere were actually field tested in Bangladesh and developed there. If you think about the vaccines, for example, smallpox vaccine back in the 18th century was actually developed by Dr. Jenner in England. If you think about oral polio vaccine by Albert Sabin, was developed in the US, but then the main field testing was actually done in the Soviet Union at the time. If you take examples of DOTS therapy, which is saving lives from the tuberculosis disease, it was actually field tested in India and Tanzania. If you think about the male circumcision as a preventative measure for HIV/AIDS, it was field tested and developed in many countries in sub Saharan Africa as well as in South Africa. So there are plenty of examples where health interventions were developed elsewhere, but now is saving lives worldwide, but also importantly within the US. Secondly, if we think about cross learning of strategies, there were many health system strengthening strategies that we use here in the US were developed elsewhere. One classic example of it would be community healthcare system. So these community health workers, which are an integral part of today's chronic disease and reproductive health strategies within the US, was actually developed in India, in Colombia, in other low and middle income countries. So it's really important to note that many health strategies, which are co-developed and tested elsewhere, are also benefiting the US. And then thirdly, if we think about doing global health research in different non-Western or non-US settings, they really inform the discoveries here as well, because many unique populations have got many unique risk factors that you can only discover if you did studies in those populations. And then, that leads to new strategies, new medicines, and that is benefiting the US populations as well. And finally, doing global health research elsewhere is really a wonderful, cost-efficient way of doing things, because in many of those settings, you can get large-scale, deep phenotype studies done in a much inexpensive manner that would be very difficult to do here within the US. But then the results are shaping public health strategies in not in just those settings, but also in the US contexts as well. So this is how global health is has been always really really useful for US health systems, as well as maintaining the US leadership in health worldwide.